Hi, my name is Dr. Geeta Yadav, and today we're going to talk about shave excisions. Shave excisions are a type of surgical procedure where I remove a lesion that is raised. It's typically done in a way that allows the dermis, the deeper layers of the skin, to stay intact and keep that strength of the skin together. I use this procedure on lesions that tend to stick out, that are raised, and that are a nuisance because of that. Shave excisions are one of the most common forms of surgical excisions. I use these to remove moles, skin tags, age spots, and the way it's done is either a local or an injectable anesthetic is applied. That is usually the only painful part if it's a needle. Then you can't feel anything. I take a blade and I remove the lesion. To stop bleeding, I might use one of a few different chemicals depending on the kind of scarring that might happen, the location, and the skin type and tone that I'm working on. That stops the bleeding, that helps with improving the cosmetic outcome, and then it's simple. I dress the area with some antibiotic ointment and a Band-Aid, and the patient is good to go. A punch excision is removal of a lesion completely through its core right down to the base, to make sure all of it is removed. I use this procedure when I am treating skin cancers, removing a mole to make sure I get the deeper layers, or sometimes for checking a rash and testing it to confirm the diagnosis. I also use this for cosmetic reasons, to remove a benign lesion or even to treat acne scarring. So let me walk you through what that would entail. What I do is I start by cleansing the skin of the site I want to operate on. I use a local anesthetic to freeze the superficial and deep layers of the skin. Then I use a tool called a punch biopsy, and it can vary in size from 2 to 8 millimeters. I apply it to the lesion, cutting it out and removing the lesion in its full depth. Then I close the area with a suture. The size of the suture, the thickness of it, the delicacy of it really depends on the location I'm operating on. And how many stitches I have to put in also depends on the size of the defect that I create. When I bring it together, I'm making sure the edges are everted, that the lesion is a nice clean line, and that it's well opposed. I then apply an antibiotic ointment to dress the area and a Band-Aid to seal it all in and protect it for the next couple of days. A cyst is a sac underneath the skin. There are many different types of cyst. Really commonly, you'll find them on the back, on the scalp. It can be in other areas. What happens is that the skin folds inwards and there is keratin and sebum and other material that's often trapped inside. To remove a cyst, you need to do a surgical excision that actually removes all the contents as well as that sac itself, the entire lining. Otherwise, the cyst can reoccur. I have the patient positioned appropriately so I can access the surgical site. I cleanse the area with chlorhexidine. I anesthetize the area with injectable lidocaine, and that includes also some epinephrine so that there is to minimize any of the bleeding. I make a linear excision with a surgical blade so that I can open up the cyst, and then I work to remove all the contents and that sac. I check around when I have completed that procedure to make sure there's no cyst lining or sac that's remaining under the skin. And once I'm sure of that removal, I cleanse the area again and I close it. I can close the cyst defect in 2 layers or 1, depending on the type of procedure and the depth of the lesion that I've had to do and the location. And after that area is treated, I will dress it with an antibiotic ointment and a dressing to seal it all in. I ask the patient to keep the area dry for a day or 2 to reduce the risk of infection. But otherwise, healing should be pretty quick. On the scalp, it can take a few weeks, the same on the body. If it was on the face, we might leave the stitches in for 5 to 7 days before removal.